Good afternoon, everyone. And on behalf of Rice University's Baker Institute for Public Policy, welcome to today's webinar on the impact of COVID-19 on the health status and economies of the Middle East. My name is Colton Cox, and I'm the Policy Assistant to Baker Institute Director, Ambassador Edward Jeredjian, and I'll be serving as the moderator for today's event. This is indeed a timely webinar since one can truly say that COVID-19 has challenged and compounded so many existing difficulties across the entire Middle East and North Africa region. And it is a special webinar today because we're featuring 4 of our different fellows within our Center for the Middle East, who each have their own perspectives on a variety of topics ranging from instabilities and migration issues to geopolitical questions that are only exacerbated by COVID-19, the least of which is not economic challenges that many states are facing, particularly oil-rich states that rely on hydrocarbons for their economies. So we have 4 fellows across the Middle East, across the Center for the Middle East that we're featuring today, the first of whom is Dr. Kelsey Norman, who is our Kelly Day Fellow for Women's Rights, Human Rights, and Refugees. She is then followed by Gilad Sher, who is our Brockstein Fellow in Middle East Peace and Security in honor of Yitzhak Rabin. Gilad is joining us today from Tel Aviv. We then have Christian Coates Ulrichsen, who is joining us today from the UK. And finally, we have our Fellow for the Middle East, Dr. Kadir Yildirim. The way this webinar will be structured is that I will ask all the fellows first to give their brief remarks on their own areas of focus related to this topic at hand today. Following this portion, I will move on to a guided discussion section where I'll have some pre-prepared questions for the fellows to discuss. But the remainder of the webinar we want to be devoted toward audience Q&A. And on that note, I'll ask all the viewers to please utilize the Q&A feature at the bottom of your screen instead of the chat feature, which will be disabled throughout the remainder of the webinar. If you do have a specific question geared toward a certain fellow, we ask that you would please specify that fellow's name. Although that being said, we certainly encourage broad questions that can apply to a number of fellows. So once again, on behalf of the Institute, I thank you all for joining today. And I will now ask Dr. Kelsey Norman to give her perspective on how the coronavirus affects migration issues across the Middle East today. Kelsey?
Thank you, Colton. Great. So my name is Kelsey Norman. My research focuses primarily on migration and refugee issues in the Middle East, North Africa. I have a book forthcoming, hopefully later this year, that looks at specifically how governments in the region respond to the presence of migrants and refugees. So today I'll just talk briefly about some of the issues I've sort of been following within this realm of migration and refugees. The first one is the presence of, or the difficulties that migrant laborers might be facing, especially in countries of the GCC, the Gulf Cooperation Council, as well as countries like Lebanon and Jordan that also have large migrant populations, workers, I should say, laborers. And I should specify that when we say migrant workers, of course, this can refer to both high-skilled and low-skilled workers, but I'll speak primarily about low-skilled workers because in times of economic recession or depression, they're often the first to be impacted. And we saw this in 2008, especially in the Gulf after the recession and the depression of oil prices. So for male migrant workers in particular, one concern with this pandemic has been that many of them, if they work in sectors like construction, they live in these large camp-like situations. And these camps, unfortunately, because of sort of the dense population and the lack of access to sort of good sanitation or healthcare services, many migrant workers residing in these facilities have been some of the hardest hit populations in terms of contracting the virus. So that's one concern. But of course, female domestic workers also have concerns during this time period. So many migrant workers, if they're female, work in domestic labor, so they live with specific families and employers. And even in normal circumstances, these conditions are sort of prime for issues like domestic abuse or withholding of wages. But those issues are sort of ripe to be exacerbated during this crisis when domestic female migrants might not have access, might not be able to leave the homes in which they're employed at all. They might not be able to sort of get in touch with other workers or with organizations that might be able to help them if there are conditions for domestic abuse. And we've seen in countries of the GCC and in countries like Lebanon, because families that employ these workers are facing economic crises themselves, they're often withholding wages from their employees. So this is a particularly difficult time for people that are effectively sort of trapped in these households. The fact that foreign workers in the GCC and in other countries of the region are contracting the virus at a higher rate than nationals has led to, of course, stigmatization and sort of xenophobia. And many countries are trying to send these workers back home, but home countries are not necessarily willing to receive workers if they have contracted the virus, because they don't think that they have the capacity to then quarantine them for a period of time before allowing them to go home to their families. So this has been sort of a difficult diplomatic and political issue as well. And of course, a huge global economic impact of this, probably what we foresee as sort of the downturn in the employment of migrant workers in the region as a result of the economic situation and the oil prices will be the ramifications for global remittances. So 2 weeks ago, the World Bank estimated that remittances globally will be down by 20% in 2020. So that will have a huge impact for things like the GDP of developing countries, but also for individual households that are very reliant upon these types of remittances. So this will have sort of long-lasting and very far-reaching implications. And then the second issue that I wanted to bring up in these opening remarks is the issue of Syrian refugees residing in the region. So 3 of the countries in the region, Turkey, Lebanon, and Jordan, are the primary host states for Syrian refugees. Turkey has the largest percentage or the largest number, and then Lebanon has the sort of largest ratio in comparison to Lebanese nationals. And refugees, broadly speaking, as well as Syrian refugees in particular, are facing different issues in different host countries. So one issue in Lebanon, for example, is that many Syrian refugees don't have legal residency. And this has been an ongoing issue that predates the crisis, the pandemic, but it's an issue that sort of exacerbates the willingness of refugees to go forward. Let's say someone feels sick and has symptoms of the virus, they might not feel comfortable going to seek healthcare or going to seek assistance if they're worried about something like deportation or arrest. And we see this issue with not just Syrian refugees, but sort of undocumented migrants worldwide who don't have access to legal residency and thus might be sort of reluctant to go and present themselves to healthcare authorities. Lebanon luckily hasn't had as large of an outbreak as other countries, or as was sort of initially anticipated. But a country like Turkey, for example, is amongst the top 10 in terms of cases of COVID-19. So Turkey has had a much larger outbreak, but it also has a larger capacity to respond. So it's sort of managed fairly well. And in Turkey, refugees, Syrian refugees, as well as other asylum seeker groups, if they have legal residency, they also have access to healthcare. So that's a huge positive. But I think one fear that we might think about in Turkey is that even before the crisis, so Turkey's been sort of going through economic turmoil over the past 2 years that predate this pandemic and the resulting economic implications. But even before this crisis, Syrian refugees were sort of being used as a scapegoat, a political scapegoat, to point to say, we can blame this group for and their presence for some of the problems that we're facing. So we might see sort of that sort of scapegoating exacerbated as a result of the pandemic and the resulting economic implications. And then Jordan, I was actually in Jordan until March 5th, and by March 14th, Jordan had closed its borders entirely, so no flights in, no flights out. By March 20th, the country had entered a full lockdown with a full curfew, and it's relaxed some of those initial restrictions, but it's still gone through a fairly effective lockdown that has resulted also, though, in very few cases, at least a few cases that are being reported. And luckily, as of last week, I heard a Jordanian official speak about how, according to government statistics, no refugee had yet contracted the virus, which is a positive. But one of the potential implications of this extreme lockdown is that Syrian refugees, many of whom are reliant upon sort of NGOs and other civil society actors and international organizations to provide basic sort of aid and access to healthcare and other things, haven't had that same sort of access. And many of them work in the informal economy, which of course has effectively been shut down as well. So I think that the real, perhaps, aside from direct impact of the virus, a lot of these groups are at risk of sort of the economic implications and are going to feel them most immediately. So I think that was about 5 minutes. I'll stop there and turn it back over to Colton.
Well, thank you for that, Kelsey. And now we'll move on to Gilad Sher to give his perspective on the Israeli situation at the moment. Gilad, I believe that your sound isn't coming in. If you wouldn't mind starting that portion over.
Is the sound okay now?
Perfect now, thank you.
Okay, so I'll start. As I said, from the Israeli perspective, the full dimensions of the crisis in the region are yet unclear. Nevertheless, I'll give you my bottom line. The virus crisis has not and will not fundamentally change trends and power dynamics in the Middle East. It serves as a kind of an aftershock of the regional upheaval that has swamped the region over the past decade. So the danger of regime destabilization and collapse of governmental systems has subsided, but not disappeared. 320,000 people across the Middle East have been infected, 1/3 of whom in Iran and 1/3 in Turkey. Some states have sought to conceal the severity of the epidemic spread. In some cases, the failure of Arab regimes to cope economically with the virus may encourage the Islamists to return to the political arena and try to further undermine stability. The epidemic has not led to greater cooperation between Middle Eastern countries. Most of the economic and health interactions have been with countries outside the region. The dramatic fall in oil prices, which has hit the oil exporters hard, lowered expectations of critical aid from Western and Gulf states. In Israel itself, we currently have 4,300 cases, 260 people dead, and 12,000 recovered patients. In the Gaza Strip, the epidemic seems to be contained with only 20 patients and 12 recovered. In this case, confinement and hermetic closure were proven successful. In terms of cooperation, Hamas quietly allowed from the outset dozens of Gaza doctors and nurses to get COVID-19 training in or by Israel. There is, however, an aggravation of the already distressed economic situation there amidst sporadic rocket launching against Israel. In the West Bank, we are aware of 350 cases, 70 recovered, and the Prime Minister, Mohammed Shtayyeh, extended the emergency decree by several months. And there is a rising wave of terrorism, individual terrorism, particularly stabbing of Israelis. Now, politically, following 3 consecutive elections in a year, Israel's double-headed government is planned to be sworn in on Thursday. In the coming months, its main task is to restore the Israeli economy to full activity. And with regards to foreign relations and security in general in the Middle East, the virus has not changed much across the region. The trends that were underway before the virus outbreak remained steady. This includes continuing Iranian subversion across the region and the acceleration of its nuclear project, as well as Turkey's provocations and its involvement in Libya. The upcoming months may see an even greater increase in US-Iran tensions against the backdrop of the pandemic. So at this point in time, it seems mandatory for Israel to refrain from unilateral annexation in the West Bank in accordance with the Trump's deal of the century. It would be a nearly irreversible action detrimental to the stability of the region. Instead, I believe that Israel can now make progress with Egypt and Jordan, as well as with other pragmatic Sunni Muslim countries, by providing medical know-how, supply of medical equipment and means, and coordination of arrangements at border crossings. To conclude, expectations for significant changes following the corona crisis in the area are yet to be evidenced. Rather, the continuity of current trends is probably a much more reasonable forecast. Thank you.
Thank you for that, Gilad. I'll now ask Dr. Christian Ulrichsen to give his perspective on COVID-19 in the Gulf states.
Thank you, Colton. Thank you very much for having me. My name is Christian Ulrichsen. I work on the political economy and international relations of the Gulf states, looking at also some of the political aspects of economic reform and the longer-term visions that Gulf governments have all unveiled over the past decade to try and cushion the transition to an eventual post-oil economy, many of which now are looking much more vulnerable than they did even 4 months ago, with the twin shock in the Gulf of the economic dislocation of corona change and also the collapse in oil prices, which continue to provide all Gulf governments with a significant majority of government revenues. So from a Gulf leadership point of view, this is a double crisis and one that really puts the social contract at the heart of relations between state and society under significant strain. Only yesterday, the Saudi government announced they would treble the rate of VAT from 5 to 15%, and they would cut citizen allowances that they introduced in 2016 during the previous oil price downturn as a social buffer to try and preempt or at least offset any potential discontent among nationals of Saudi Arabia that when new fees and taxes were being introduced. And so some of these safety measures are now being rolled back just at the time when economically the impact of COVID-19 also has hit squarely upon the sectors in the Gulf that have been really much the poster child for economic diversification. If you look at the Gulf economies and you think of non-oil, you think of some of the airlines of Emirates, of Etihad, of Qatar Airways, of the airports, of the hubs, the logistical hubs, which are all now impacted by the almost standstill in international travel, in trade, in meetings and conferences and big events, and of course in the mega projects as well, such as the future city on the Red Sea, NEOM, that Mohammed bin Salman in Saudi Arabia is really trying to put together. So this is very much a double crisis happening in the Gulf. In terms of the actual public health impact of coronavirus, the situation in the Gulf is, on the one hand, quite encouraging in the sense that the death rate has been very low compared to the number of cases. And that could partially be because of the higher quality of healthcare, of hospitals, of the very quick move to lockdown at the beginning of March to suspend international travel, the availability of PPE, personal protective equipment. But over the last 2 days, Kuwait and UAE have both recorded largest number of new cases since the pandemic began. So there's clearly a long way to go. And as Kelsey had mentioned, the fact that in all the Gulf states, you have large numbers of foreign workers living in close proximity in often unhygienic conditions really gives a potential for labor camps to become hotbeds for the spread and further spread of the virus. And we've seen in several Gulf states, in Dubai and in Qatar and also in Kuwait, how hotbeds of kind of cases have definitely taken root among migrant workers, and this could also exacerbate social tension as well between citizens and expatriates if different groups are being blamed for either being perceived or the spread of the virus. So there could be an ugly blame game that could begin to develop as well, especially if governments are seen to be not able to get a handle on the situation. And then just finally, I'll talk about the situation in Yemen. Yemen is, of course, an Arabian Peninsula state. It's not part of the Gulf Cooperation Council. But as the Saudis and the UAE have found, they've been heavily invested in Yemen over the last 5 years from a military perspective, but also heavily now invested in trying to move towards a political resolution of the conflict. The Saudis announced a ceasefire in mid-April, lasting for a month in Yemen. But the prospect of COVID-19 really taking root in Yemen could be absolutely catastrophic. It would build upon more than a decade of dislocation of internally displaced people, of migration of Yemenis and also people from the Horn of Africa to Yemen. The fact that Yemeni health system is already heavily strained by cholera, by diphtheria, by other disease, by other illnesses that are really placed under strain, by the warring parties in Yemen, not just between the government and the Houthis, but between the government and the Southern Transitional Council now as well. And by the fact that 6 years of war have left almost half of Yemeni healthcare facilities less than fully functioning. So the situation in Yemen, which already was the world's biggest humanitarian challenge, could get a whole lot worse very quickly. And I think from a policy perspective of the US as well as the Gulf states, which have been trying to find a way out of Yemen's descent into humanitarian and military kind of disaster, COVID could really be the last straw and sort of a thing that could really create a kind of perfect storm in the coming weeks and months. So with that, I'll pass you back to Colton.
Many thanks for that, Christian. And for the last set of opening remarks, I'll pass it over to Dr. Kadir Yildirim to talk about the Turkish sphere.
Okay, hi. Can you see me? Good afternoon. So my name is Kadir Yildirim. I study religion and politics in the Middle East and Turkish politics. So I want to talk about some about Turkey, what's going on in Turkey in terms of the current pandemic situation. So looking at the public health sort of dimension of the issue, there are approximately 140,000 cases in Turkey, which ranks in the top 10 globally, pretty high number. And there are approximately 4,000 deaths. So as such, Turkey is one of the worst hit countries in the Middle East. There are some sort of, there's some speculation suggesting that there's a large case of undercounting, and there's also likely data manipulation in terms of the number of deaths in the country. So we don't know the extent of those, but some indications there are in terms of the expected number of deaths on any given sort of month indicate that there's huge reporting in terms of the number of deaths from the coronavirus. So Turkey is facing a big public health crisis. One particular example of that is in prisons. Turkey released approximately 100,000 prisoners after some of the early sort of measures were taken for the fear that it's going to spread rapidly in prisons. However, most of these prisoners that were released were not political prisoners, but others, regular criminals. But the problem is there's a concern that the government is using among the opposition. There's a concern that the government is using this current pandemic to further spread the coronavirus in prisons against political prisoners. And We don't know the extent of it, but some informal reports suggest that the conditions are not very good right now in prisons, and there are a lot of prisoners from some of the major political parties, such as the Kurdish HDP right now. So things are not going well from a public health perspectives. And I think more sort of broadly, we can suggest that it is no coincidence that this pandemic is worse in countries where politics are prioritized over public health concerns. And another dimension that politics and economies prioritize over public health is the growing economic woes of Turkey. Even before the pandemic, Turkish economy was struggling. The fallout from the corruption scandal of 2014-15 and the following erosion of the rule of law and the post failed coup attempt sort of suppression of pretty much of all the society, politically, economically, socially, since 2016 has decimated investments in the Turkish economy. Turkish economy has not been able to recover since that downturn in 2013 and 14. So as a result, the government is really concerned about the state of the economy, more so than they are about the public health aspect of this crisis. And as a result of that, the government hastened to open up the economy, even though the cases are not significantly down yet. And there are no measures to ensure, no testing, no tracking at a large scale to ensure that this is going to be safe for the population. The government has imposed tariffs on certain sectors, tried to implement an economic help package to people who lost their jobs. But compared to many other countries in the West, in particular, this package was a result of not government bailout or government help, government financial assistance, but rather it is through sort of donations and public health campaign, which is kind of pretty unique, I think, in many ways. And it has had some success, but not a whole lot. There is, the currency is losing its value. There is efforts to sort of open up lines with the Fed and other governments around the world, in other central banks around the world, to help the Turkish sort of central bank and Turkish economy. But so far, hasn't been much success. And the pandemic is aggravating the existing sort of grievances of, in particular, of the opposition against the government, with the accusation that the government has not been able to handle the response to the pandemic sufficiently. I will stop here and we can continue later.
So thank you, Kadir, and all panelists for those opening remarks. I'll now move into a portion that will be a guided session to build on some of the themes we've already discussed. I'll also remind all viewers you're more than welcome to currently submit questions through the Q&A feature that we will answer in the next portion. And for this session, we'll start again with Kelsey. So Kelsey, you've already talked about the challenges faced by refugees and migrant communities across the Middle East, but to tie it back in again to the Syrian conflict, we know that the Syrian conflict is still very much ongoing, especially in the province of Idlib, where there are millions. It's a 1 million strong population, and many of those are internally displaced persons from other portions of Syria. So could you speak a little bit about the measures that are being taken to mitigate the spread of COVID-19 in this region, at the same time where fears of armed conflict are still very much abounding?
Sure, thanks, Colton. So as Christian alluded to in the context of Yemen, I mean, I think one of the major issues that Idlib and Syria generally are facing is that we're talking about a region that's been under, an onslaught for quite a while, and many of the medical facilities, especially in the most recent sort of bombing campaign. So Idlib was under attack, and there was ongoing fighting between Turkish forces and the Syrian government. But as a result of these incursions in December and January in particular, many of the medical facilities were specifically targeted by the Syrian regime and Russian air forces. So the medical sector has been effectively decimated in the region. And so with that in mind, thinking about, there hasn't been a major outbreak yet, although there also isn't a lot of testing being done. But if a major outbreak were to occur, and it seems sort of potentially ripe for that situation, it could be really catastrophic. And Colton, as you mentioned, Idlib is an area and sort of the last battlefield of the Syrian civil war, whereby many individuals from other parts of the country have been displaced over the course of the civil war. And then within Idlib, there are an estimated 1 million individuals that have been displaced, whether they're residing in camp-like situations or in smaller towns or cities. So there has been a ceasefire in place since March between the Syrian government and Turkey. So whilst there may not be much active fighting, there also isn't really much of a chance for people to return home, or there's always the possibility of future fighting. I think I read that about 10,000 people have returned home to their homes in Idlib, but that many people's homes have been destroyed. So there's still ongoing, a massive displacement situation. I think the real one very, very pressing issue is that there's been a resolution in place since 2014 that allows UN operations to cross into northern Syria and other access points throughout the country. But there's 2 important crossings in northeast Syria from Turkey that the UN has been able to through those crossings, the UN has been able to carry out humanitarian assistance on an ongoing basis since 2014, even without the permission of the Syrian government. So these have allowed, critical medical assistance and other types of humanitarian assistance, food, to get through those crossings. And it's been sort of constantly renewed on an annual basis, but in late 2019, there were limitations put on that and at the UN Security Council because of pressure from Russia and the Syrian government. And as a result, two of the 4 sort of major crossings were closed. So the 2 important ones that remain open, the resolution protecting those openings is due to expire in July 2020, so in 2 months. So the Syrian government would prefer that all aid operations be channeled through Damascus, that they have complete control over what aid is allowed into Idlib, because they don't like this aid necessarily coming in directly from the UN, because they think that it sort of prolongs the conflict and helps these opposition groups continue to fight. But I think in reality, and with the current situation and the possibility of an outbreak of a pandemic in the region, it's really critical that those UN humanitarian operations are allowed to continue and that resolution be renewed in July. So I think that's one of the most pressing issues surrounding the pandemic, as well as the ongoing situation in Syria.
Perfect. Many thanks for that, Kelsey. The next question I'll direct again toward Gilad Sher to touch again on something you've already discussed, which is the Israeli-Palestinian conflict. So it's no understatement to say that COVID-19 has really changed the political landscape in Israel with April's coalition agreement between Benjamin Netanyahu and Benny Gantz, as you described. So just as the months progress and as there's a possibility of discussing West Bank annexation in the Knesset, and even now, as we see Secretary Pompeo traveling to Israel this week, how do you see the virus affecting the US-Israel relation and the broader Israeli-Palestinian conflict?
Well, I don't think that it affects significantly, because in terms of annexation, the Trump deal gives Israel a green light to initiate unilateral annexation or accomplish its equivalent by extending the Israeli law over Jewish settlements in the West Bank and the Jordan Valley starting July 1st, 2020. Trump's plan envisions a 4-year timeline, indeed, for the implementation. Yet the potential sequencing of the plan, first Israeli annexation, then the rest, if at all, it negates the possibility of a functional process. And I believe that Netanyahu's government will attempt to take advantage of this window of opportunity from July to September or October, and attempt to annex parts of the West Bank. And the scope is not necessarily important, because some of the annexation process will be completely irreversible. By the way, you mentioned the Knesset, but according to the coalition agreement, it is enough to have a governmental decision on annexation, and both double-headed prime minister and deputy prime minister are not bound to bring any kind of such action to the Knesset.
Many thanks, Gilad. The next question I'll direct again to Dr. Ulrichsen, and you've already given us a very thorough overview of the economic situation in the Gulf countries, particularly Saudi Arabia. And to hone in on Saudi Arabia more, could you speak more about how leaders and citizenry alike have reacted to the economic difficulties caused by decline in global oil prices that's only been exacerbated by COVID-19, and in particular, how that affects these strategic development plans that many Gulf states have, such as Saudi's Vision 2030 plan?
Well, first I'd say that the Saudi leadership, I think, miscalculated the impact their decision to increase oil production in March had in terms of straining Saudi-US tension. The Saudis don't seem to have anticipated that they, rather than Russia, would have been blamed in the Trump White House for contributing to the collapse in oil prices. That the depth of that discontent from the US, I think, was a surprise to the Saudi leadership. And of course, the leadership in Saudi Arabia under Mohammed bin Salman has staked so much of its credibility on the notion that he, and only he, can transform the Saudi economy, which is the heart of Vision 2030. And Vision 2030 was always an ambitious set of objectives, almost more of a roadmap than a sort of way from getting from A to B. It was already being downscaled or downsized as the complexity of actually pushing from change on paper to change in practice was becoming clear. And I think Mohammed bin Salman now faces the potential challenge that he is seen to be not being able to follow through. Rather than giving Saudi youth, especially, chances of a good job, of an economic livelihood, they'll be hit now with new taxes, new fees, and a decline in an already difficult job market, a decline in prospects. And so for someone who has sent such a strong message over the last 4 years that I'm your man, I can change Saudi Arabia. Oh, and by the way, nobody else can do it, so don't even think about potentially backing someone else. That is going to be very difficult to recover from, unless, of course, the severity of the pandemic and the dislocation of the economic impact is such that Saudis realize that this is not Mohammed bin Salman's fault. This could be an opportunity to reset Vision 2030 to try and make it more sustainable if the government can play its cards right and avoid being stigmatized for their failure to follow through on those high sounding promises of 2016, 17, and even 2018.
Thank you for that, Christian. The next question I'll direct toward Kadir. So you've also given a good overview of the economic situation in Turkey right now, but that domestic economic struggle, how has that affected Turkey's foreign policy in any way, particularly with its southern neighbor of Syria, and also when we look at other power players in the region, such as the Kingdom of Saudi Arabia or Egypt?
So Turkey's economic woes are, I think, fundamentally, intricately connected to its sort of foreign policy choices as it relates in particular to its relations with the West and the US, and as an extension of that, its regional foreign policy. One tangible example of that is Turkey's purchase of S-400 missile systems from Russia recently. And this was predicated on the understanding that Turkey is going to move at least to a significant degree, towards Russia and away from the West, in particular US and NATO. The problem is Turkey is dependent on the West in terms of its economy, not Russia. Russia is not in a position to be able to provide Turkey any kind of financial assistance, financial help. So Turkey is kind of in a bind. Turkish government needs to make a gesture and demand help from the West. And as a result of that, Turkey has opened, or is holding talks to open swap lines with several central banks, and all of them pretty much are from the West, including the Fed. So the deal is there's no financial help to Turkey, economic help to Turkey, unless there is a significant change in this sort of Turkey's orientation toward the East or the West. So as a result of that, Turkish government decided to announce that in April that the activation of the S-400 missile systems was suspended indefinitely, presumably until a much later time when the economic sort of troubles are resolved. And the goal here is to convince the U.S. and the West that Turkey is behaving now, and it sort of deserves financial aid and sort of a kind of a bailout, from Western governments. But the problem is we don't know how sort of sincere this change and shift will be eventually. Whether Turkey will actually activate S-400 missiles after the pandemic is over and the economy is back on track, or whether this represents a fundamental shift in Turkish, or more significant, Erdogan's approach to its relations with the West and the US. In terms of its regional ambitions, there's not a whole lot of change in Syria right now. One indication of Turkey's sort of ambitions not subsiding as a result of the pandemic is that there are some reports indicating that Turkey is training some militia in Syria right now with payments of up to $5,000 a month to every militant. And part of their contract requires them to go fight in Libya for Turkey for about 3 months. So Turkey is aiming to make some big gains in Libya. So what we can deduce from that is Turkey is trying to find an opportunity to extend its influence and gain an edge in several conflicts in the region, including Syria and Libya. Thank you.
Thank you for that, Kadir. The next question I'll frame as somewhat of a lightning round question for any of the participants who'd like to give a response. I'll tie it back to US foreign policy now. So especially in the midst of an election year, as we are now, what do you see as some of the greatest uncertainties for US policymakers in the Middle East? And especially, how are these foreign policy uncertainties further exacerbated by the coronavirus? So to whomever would like to respond first, we can go around the panelists.
I'm happy to start. I believe that one of the challenges for the US policy is to coordinate with its allies in the Middle East secretly in order to be on the same page on the red lines vis-a-vis Iran and its nuclear race. This is one of the main problems that persists in the Middle East, and we need the United States to coordinate its actions, its policies with not only with Israel but with the others. The second part relates to the Israeli-Palestinian conflict. The Trump plan will shape the negotiation process for years to come. And this is really regardless of the results of the US presidential elections. And it will serve as a point of reference in future negotiations for whoever, for those who are strongly in favor of it and those that are staunchly opposed, just as many other plans in the wastebasket of history have continued to influence the peace process. So since all parties involved will bear the consequences of the peace to prosperity plan or the deal of the century, I believe that the United States needs to examine the implementation issues and the proposed frameworks, as well as how Israelis, Palestinians, Arab states can navigate towards a more peaceful situation. So I believe here that the challenge is to have an American policy that is characterized by restraint, moderation, as much as possible in any step, in any measure taken, particularly in the irreversible actions such as unilateral Israeli annexations of parts or all of the West Bank.
Thank you, Gilad. Now to whomever else might like to answer. Kelsey, if you'd like to go.
Great, thanks. I guess I would say one concern I have with the election, but also with the economic fallout in the United States from the pandemic, is sort of increasing cuts from the U.S. and sort of its willingness to continue to relinquish its role as sort of a leader in humanitarian assistance for the region globally as well. I think this, I'm worried that the administration, if it's reelected in November, especially, will use the pandemic and economic fallout from the pandemic as sort of a means to justify an agenda that it really wanted to accomplish anyway, which is basically, cutting humanitarian assistance or sort of its involvement with humanitarian issues globally. And we can see this in previous actions. So, for example, cutting the number of refugees resettled to the US each year down to sort of the historic lows that it's currently at. The cutting of its funding to UNRWA, the Palestinian refugee, or the organization that works with Palestinian refugees in the region, as well as actions unrelated to sort of my research topics. Most recently, of course, pulling out funding or threatening to pull out funding from the WHO, which of course had political justifications, but nonetheless sort of addresses this broader agenda whereby the Trump administration hopes to continue to remove itself from financial entanglement or contributions to humanitarian situations globally. And I would hope that if there is a if there is a transition in November, that if a Democratic leadership were to come to power, they would consider reversing some of these trends. And despite the economic fallout from the pandemic, to consider sort of the vital implications of humanitarian assistance, whether it's in Syria or to other situations in the region. I think it's of vital importance.
Thank you to all, and we'll devote the remainder of the webinar time to questions from viewers, and I'll encourage all viewers again to continue submitting questions if you'd like. And the first I'll start out with, I'll direct toward you, Christian. It's tying back into the Saudi question about global instability and global geopolitical instability with oil prices, but particularly the Saudi domestic response to that. So do you believe that Saudi is prepared to reduce oil production in the future to less than 6 million barrels per day if required? And in turn, what will Saudi do if other OPEC nations decide to violate their quota? So in effect, do you see these global tensions still continuing, and what will Saudi do in the face of these?
The Saudi leadership, I think, is still haunted by what they had to experience in the mid-1980s, when they cut production way back to something like 3-4 million barrels a day. And they still didn't necessarily achieve what they wanted in terms of market share or oil prices being restored. So they lost market share and oil prices remained low. And this has really had a long-term impact on the leadership thinking. People like Prince Abdulaziz, who is the brother of Mohammed bin Salman, who's the Saudi energy minister, who's been in the energy business now for more than 30 years. So there's a real concern that if the Saudis cut further, they'll be taken advantage of either by the Russians or by other OPEC members who don't abide by quotas, or even by if prices begin to restore by producers in the US and elsewhere. So I think they'll continue to cut. They've announced another 1 million barrel per day cut, but at some point, there may be a feeling that they have to do what's best for their interests. And that, again, could see a recurrence of what we saw in March when a Saudi decision to act in their interest leads to a kind of head-on clash with the Trump administration, with the US government, now that the US government is itself a major player in the oil business.
Thank you for that, Christian. And the next question is somewhat of a macro view. It's asking, are there any Middle Eastern countries in danger due to unemployment, in danger of revolution due to unemployment? So this harkens back to what we saw with the Arab uprisings of 2011, that there were many disaffected and dissatisfied members of citizenry across the Arab world. So do we see any current dangers posed by this with unemployment as a result of COVID-19?
I guess I'll just say quickly that, of course, there were sort of revolutionary movements happening prior to the outbreak of the pandemic in the region, right? So we can look at Lebanon, and we've seen recent rioting there, but it's in many ways a continuation of what was happening before the outbreak of the pandemic. And in response to situations that are not going to be ameliorated by the pandemic, will only become worse in terms of corruption, financial catastrophe, lack of government accountability. So those issues are ongoing, and however the pandemic continues to unfold or eventually maybe is resolved, those issues will linger. So I don't think it's simply a matter of the pandemic necessarily causing this unemployment that will lead to potential either continuations or new uprisings. I think that there's also, many issues that remain unaddressed, and perhaps in Lebanon, the movement has been somewhat disrupted in terms of the physical ability for people to be out on the streets, although we have seen some protesting recently. But many of the individuals that were involved with that movement have continued their protests through other means, whether it's online or trying to find other ways of expressing their discontent. So I think that there's factors at play that will continue beyond this particular health and public crisis.
I agree about the analysis that Kelsey just gave about Lebanon. I'm not sure that we're talking about revolutions. We might talk about upheavals, uprisings, etc. And in that context, I would like to take a closer look at Egypt, who is struggling economically in a way that that might create the same traction that we saw in the first half of the last decade.
Well, thank you for that. And we have another good audience question that is asking how the impact of COVID-19 on economies in the Middle East will in turn affect US economic recovery. So how should the US consider its own timeline for recovery in light of turmoil in the Middle East?
Well, I would just begin by saying that obviously investments from especially the Gulf Arab states into the US economy have been responsible for major foreign direct investment, of job creation, especially in the energy sector. And if these begin to dry up, and also in, for example, major arms purchases in the defense sector as well, if these begin to dry up, it could also have a knock-on effect. And for years now, the Gulf Arab states have been among the biggest investor countries in a whole range of industries across large parts of the Western world. And so were that to dry up for any significant period of time, it would definitely have an impact.
We have time for a few more questions, and I'll turn the discussion eastward, if you may. So obviously, a big geopolitical question surrounding COVID-19 is that of China, and China's role in the Middle East has perhaps come under more scrutiny, especially with its Belt and Road Initiative. So to whoever would like to comment, what exactly do you see as the future of China's role in the Middle East? And do you see any concerns about that in light of what we're seeing currently across the region?
I'll just say quickly on a topic I already mentioned in regards to the Syrian conflict. I would hope that with China sort of trying to paint itself as a leader in regards to responding to the pandemic and sort of maybe in opposition to the US, that it might consider sort of reframing its approach to Syria in regards to putting the pandemic first rather than aligning itself with the Syrian government and with Russia. So, you know, ensuring that, for example, the WHO has access to Northeast Syria and Idlib to carry out the necessary testing to understand, you know, how many people have contracted the virus there and what the spread is like. So perhaps there's, you know, a chance here for China to play sort of a different role in that conflict than it had been playing previously.
If I may add something to in the U.S., Israel, and China triangle here, as I said in the at the outset, the crisis has not and will not fundamentally change the trends and the power dynamics in the Middle East. And China is basically here to stay, economically at least. And I believe that one of the most prioritized topics on the Israeli-U.S. Agenda should be to subside the tensions between the U.S. and Israel on the part of China within the Israeli economy.
Thank you for both of those, Kelsey and Gilad. Kadir, I'd like to tie back to another question that was submitted earlier, specifically about the conflict between Turkey and the Kurdistan Workers' Party, the PKK. That's a long, enduring internal conflict for Turkey and something they have to think about on top of this conflict. So if you could comment about how that conflict might have been affected by this pandemic right now.
Okay. Well, the conflict has slowed down in recent months, even before the pandemic, in response to Turkey's operation in Syria, because of, you know, Turkey has been attacking, you know, the ally of PKK in Syria, which Turkey considers its ally, and there's a good bit of evidence that this is the case. That is PYD. So Turkey has been undermining sort of this alliance, this cooperation between the two. So for many months, the attacks on Turkey by the PKK within Turkey has been fairly low. The incidence of hot conflict has been fairly low. In addition to that, Turkey has been taking action against the sort of Kurdish political opposition in Turkey in the form of HDP. So a lot of the mayor positions, local governments have been sort of attacked by the Turkish government in the form of replacing those mayors and local governments by centrally appointed figures that are more sort of pro-government rather than Kurdish oriented. So this undermined a lot of the, you know, activism and the room that PKK could operate within. On top of that, with the pandemic going on, you know, all the movement has been sort of severely restricted in the country, nationwide, including the eastern parts of the country. So the potential for any kind of violent action and the gains, you know, the benefits from that for PKK has diminished significantly. So the conflict has been sort of put on freeze for a good while, not because there has been any sort of a solution to it, but because the current conditions make it sort of fruitless, essentially, for PKK to attack the Turkish government.
Thank you for that, Kadir. Unfortunately, that concludes our time for the session today, but I will thank all the panelists and also all the viewers. And I'll also say to all the viewers to feel free to continue this conversation, either by reaching out directly to any of the fellows here or viewing their research online. We definitely want the fellows to be accessible for any further questions that weren't able to be answered here today. So we thank you all again. And on behalf of the Baker Institute, we wish you all well.